everyone, and welcome to my what on earth is chronic fatigue and ME / my story video. So I did try and film this before, but it got way too long, and then I said something. I was like, actually, I'm not comfortable with putting that on there. So basically, here's my story. In 2008, I had glandular fever. At the time, we thought it was tonsillitis. It became very apparent it was glandular fever when I wasn't responding to penicillin, and it showed up in blood, etc. And yeah, so my glands were very swollen, and I lost a lot of weight in this illness. I mean, my throat was like tiny like this. Fried eggs are really good if you ever get this illness. I really should have gone to the hospital and have an IV drip, but you kind of don't always know at the time, so but I mean, in retrospect, yeah, or if I had it again, I would just be like, no, I need an IV drip, because losing 2 stone, I really didn't need to lose that. So yeah, so basically after that I just felt really tired, and I just thought, oh, it's just, the kind of residue or whatever, but I felt a lot better than I had done, so I was like, oh, I'm sure I'll be fine. Yeah, what happened after that? So that happened. So after recovering from glandular fever, you're not supposed to drink for 6 months. I didn't know this, and I went into university and I did drink quite a bit. And so obviously I always call it, I trashed my system unknowingly. So yeah, that was really difficult, and I kept on getting like weeks where I'd just be really sick, which was a bit frustrating, and I knew something wasn't right, but I thought, oh, I'm sure it's fine, I'm not sleeping great, and I mean, I had 4 hours sleep some nights. It was ridiculous. I became a little bit insomniatic, but yeah, so I mean, obviously that happens to a lot of people at university. University is crazy bad for your health. Or personally I feel it can be. So yeah, at the time I was very low, so it was a difficult time, and again, I will probably film a video about my depression and anxiety, because I had struggled with that in the past. But anyway, this is more about chronic fatigue and my general health. So back to that. Yeah, so I knew something wasn't right, and I think after uni I was kind of like, okay, let's knack the doctors. So I went to the doctor and asked, and they gave me a blood test, and they didn't ring me back. And at that point I just thought, oh, it's fine, they would ring me if there's anything wrong, and I wasn't kind of assertive enough to be like, right, I need to ring them and actually ask them. Or I think I might have rung them and they were like, no, I can't remember, so it's not really important because I can't remember. So yeah, I started to get quite unwell, and I think it was getting worse, and that's partly why I kind of pushed it with the doctors. So about a year later, I went to them and said, look, I am really tired all the time, what is going on, help. And the doctor was lovely, because she'd seen I'd been pushing them for like a couple of years about this. Obviously in my notes it said repeat complaints of being tired. I'm just gonna switch hands, my sleeves being really annoying. Right, there we go, sorted it out. Yeah, so I had a big blood test, and they basically checked for everything, kidney function, liver function, diabetes, for example, and basically they found my thyroid was not working properly. So basically it was like, oh yeah, liver check, yeah, kidney's fine, thyroid will come back too. And it was like, then he started going off and being like, no, that's fine. And I was like, what? Wait, thyroid? And so he came back to the thyroid and was like, yeah, we think you have an underactive thyroid. Your levels aren't quite right. He said, I'd like to try you on levothyroxine. I think they've put me on 50 a day, I think it was, so 50 micrograms. And about half an hour after taking these tablets, I started feeling amazing. I only take 1 a day. I don't know why I said tablets. And yeah, so I felt like superwoman, if I'm honest. It was amazing. So, if you ever feel tired, always ask your doctor to check your thyroid. It's more common in women than it is men. I don't know, have a clue why. But my theory as to why mine stopped working, I think it was after the glandular fever. My tonsils, yeah, my tonsils and my glands are so swollen that it must have pushed on my thyroid, because your thyroid's like around here. Yeah, so that's my theory. I am sticking to it. It might not be medically proven, but that's what I'm going with. So yeah, I started feeling better. It has been up to, since then. So I've gone from 50 to 100. I mean, to be fair, it's changed once before pregnancy, and then it changed during pregnancy. It's pretty normal for it to change during pregnancy, so all the hormones like pumping around your body, so I'm not too worried about that. And then, yeah, so that was 2012 November. I realised I still didn't feel right, and I just started feeling worse again. I was like, is it my thyroid? So obviously they double checked my blood again, making sure my thyroid levels are all okay. They did this a couple of times, because once my thyroid did need upping. My thyroid meds needed upping. Yes, and then I really didn't feel great, and I was just like, I think it's more. And so I had a chat with the doctor, and they were like, okay, what we're going to do, because they decided that I might have chronic fatigue syndrome. And so they sent me off to have a referral to the rheumatologist. And this was last year, so 2015, probably about November. And I went in and had a chat with him and explained my symptoms. He actually made sure I didn't have arthritis, because some of the pains I was getting, or some of the pains that you get with chronic fatigue / ME, which I will come back to why it's / in a minute, can be arthritic. So obviously, like, they wanted to make sure that I didn't have arthritis, which thankfully I don't. But yeah, he did then diagnose me with chronic fatigue syndrome at the end of that session. And I think it can be very common if you overdo it after having glandular fever. So I'm looking on my laptop because I've got like a little bit of information about ME and stuff, so that's why I keep on looking over here. So it's very common with glandular fever, if you overdo it afterwards, it can develop into chronic fatigue syndrome. So it was almost like, actually medically it made sense. So yeah, that's when I got diagnosed. I will come back to where I am now with it. But first I'd really like to explain actually what on earth is it. So chronic fatigue syndrome, stroke ME, which is kind of what they call it. It's the same thing. So chronic fatigue syndrome, ME stands for myalgic I'm going to try and pronounce this. Yeah, I can't pronounce that. Dyslexic. At least I gave it a go. So basically it's a long-term thing where you just feel tired a lot. And it's not just like, oh, I'm tired, I've been up all day, or it's, I've had a long day at work. It's I woke up and I felt like I'd already done a day at work. That's how tired I was. It wasn't like, it was no logic to why I was tired, and this is why. It was sort of like, what is going on? I've not even done anything. And I mean, obviously when you don't do anything, it can, make you feel tired, but it wasn't like I didn't exercise or anything. So I think that was a major thing. Yeah, and I mean, other symptoms like muscle pain. So I was getting really, really bad muscle cramps. That's more ME than it is chronic fatigue. So I will again explain that in a minute, what I mean by that. And I mean, it's describing it here on my laptop. I'm reading kind of what it generally describes it as. Disturbed sleep patterns, poor concentration, headaches. And it says the cause of this isn't known. I have heard it being called post-viral fatigue syndrome, which would make more sense to what I had, which is obviously post-glandular fever, basically. I mean, I had disturbed sleep patterns because I slept a lot. I was getting muscular pains. It does say joint pains. I didn't mention that, but I didn't get any joint pains. I have poor concentration because I'm dyslexic, so that, yeah, who knows. I didn't really have a lot of headaches. I mean, obviously, some people sort of have different kind of symptoms for any illness. It depends on your body. So the most recommended treatment is graded exercise therapy. So you kind of build up the exercise that you are doing. And cognitive behavioural therapy, which I have had in the past, and yeah, to be honest, it didn't really make a difference in illness wise. But I mean, graded exercise therapy is the most sort of research into and most positive results. It doesn't work for everyone. Some people, it can make you worse, so it's very sort of, swimming's very good for that. So I do that now, so I do swimming and walking, so it's not really strenuous on my body, but it gets me the exercise I need. So with chronic fatigue syndrome, chronic obviously means persistent or long term is what it's saying on here. ME, basically, malic, I think that's how you pronounce it, malic, basically means muscle aches or pains, which is what I got. And the E, which I'm not going to try and pronounce again, I've done it once, I've learnt, means inflammation of the brain and spinal cord, which I don't think I quite had. Some people say ME is just basically a severe version of chronic fatigue, but they're the same thing. What it says here is the term CFS, so chronic fatigue syndrome, is used by doctors. This is because the main symptom is fatigue and the condition is chronic. And so there's disagreement of the presence of inflammation in the brain or spinal cord, which is implied by the E in ME. The term ME is preferred by people with the condition. Some people with the condition feel the word fatigue is an everyday word, which does not reflect the severe case of what they have. As I mentioned before, it's not just I'm tired after a day of work. It may not be the main or only symptom. Some people believe that there are two separate conditions, CFS and ME. Other people believe the two conditions are the same, but symptoms can vary. What I understand is they are the same, but chronic fatigue syndrome is the milder version of ME. So it's kind of like every illness has a scale. So if you've got it mildly, it's chronic fatigue. If you've got it severely, it's ME. Sometimes I would use ME because more people had heard of ME than chronic fatigue syndrome. So basically, then, this site then goes to say about how glandular fever can affect it, or even the flu can sort of trigger it off. There's not a lot of research on it, so it is quite difficult at the moment. It does say factors that are thought to contribute to some people developing it include inherited genetic susceptibility, viral infections such as glandular fever, exhaustion and mental stress, depression, traumatic events such as bereavement, divorce or redundancy. I had quite a few of them happen, so it's sort of like, okay, well, then it says the following is supposed to make them worse. So recurring infections, not being active enough, stress, poor diet, being socially isolated and or feeling frustrated and depressed, environmental pollution. And again, a lot of those were relevant to my lifestyle at the time. So I'm just having a look here. It's interesting because it then kind of describes about fatigue, and I think this is very useful, which is why I'm reading it. It's not just because I'm like, ooh, I don't know how to describe it. Basically, it's very different to everyday tiredness, such as a day's work, as I mentioned before. It's not eased much by rest. It's not due to tiredness feeling overexertion. So obviously, if you go to the gym and you feel tired after it, it's not like that tiredness. And I can vouch for that because it is not like pregnancy tiredness, for example. Pregnancy tiredness I would probably describe as sleepy, whereas like chronic fatigue I describe as exhaustion. It's like when I had it worst, I would not be tired. I just skip straight over and go straight to exhaustion. It's not due to muscle weakness, or like it's not due to depression or anything like that. Obviously it can make it worse, but it's not due to it. So basically then this website, which I'll link below, it just goes on about like mild cases, moderate cases, severe cases, and management and stuff like that. So basically, as I said before, graded exercise therapy and cognitive behavioural therapy are the most sort of medically researched into methods of getting better. So yeah, that's basically what it is. It's prolonged tiredness that is not just I'm tired after a day of work. There is a big difference between this tiredness and the tiredness that you'd feel after exerting yourself. And it's mainly just, it doesn't, when you've, had a good day at the gym or whatever, you feel, you've got the endorphins running around and you feel like you've done a good hard work. Whereas with chronic fatigue, when I had it, it was just really tiring. It was just, I felt like I could barely do anything, and I was in bed a lot because I was just like, I just felt so exhausted a high proportion of the time. And I mean, yeah, I feel tired now because I'm pregnant, but it's very different. So anyway, what I basically did graded exercise therapy. So I went swimming, I had a little cycle pedal machine, and I did walking. So nothing majorly strenuous. I stopped cycling because that was too much exertion for me. And so I think I would always sort of try and be like, oh, but I always used to cycle and stuff like this. And I'm like, yeah, but this isn't what your body is like now. So I had to kind of treat my body with what it was now. And I think that's good advice anyway, just generally. So yeah, I had to really take a step back and decide what I wanted to do, because especially with the muscle pains, it was agonising when I was working. It was just, yeah, so that is partly why I left my job that I had at the time, because I needed to get better and my health is more important. I said I would rather get better completely and just not work for, say, a year or so, and then struggle through work and then not get better for, another 5 years or something. So that's partly why I left my job as well. Then once I left my job, I did some volunteer work just to keep me going and just gradually sort of increase it, which is what they kind of suggested. He said it's not a good idea to stop work altogether, but it is a good idea to reduce hours and then build them up. So that's basically what my plan was. And at the time we were trying, and I did speak to the doctor and I said, look, we are, what are your thoughts? And he said, yeah, that's fine, go for it, it's not an issue. So yeah, obviously I did start feeling better, but and this bit here is obviously, so obviously this is my belief. So when I'm getting into this territory, you don't have to believe what I'm saying. This is just my story, and I just, all I ask is that you respect my story. So basically I volunteered in a church and they offered to pray for me, and I said, look, I'm getting really tired of being tired, basically. And so they prayed for me, and I don't think I'd been feeling muscle pain just before, but that was 6 months ago, and I have not felt one muscle ache since then. It has been truly amazing. Like, when you feel pain every day, to then have that completely released is just insane. Like, I have no words, basically. I remember on the day I got prayed for, I just started to feel so much better, and I was moving furniture and things like that, and I still don't have words for it, but thankfulness that passed me I believe that God healed me, and I thank those who prayed for me, and I think it is literally just a miracle for me. But yeah, and 3 weeks later, I ended up pregnant, and obviously then it was about 6 weeks, another 3 weeks before we found out. But it was just amazing timing and amazing, just provision really, because obviously you get tired when you're pregnant. So the one thing is, obviously I'm still feeling tired, but I can tell the difference between the pregnancy tiredness and the chronic fatigue tiredness, and I really wouldn't say I have chronic fatigue anymore. I really wouldn't, because I'm in my second trimester. I'm currently 19 weeks and 1 day, and I feel much better than I would have on a day with chronic fatigue, and it's amazing. And yeah, it's crazy, and I have no words. So the thing is, I'm not gonna blabber on, because you know that I'm chatty if you watch any of my videos, so anything that makes me speechless has got to be pretty impactful. So yeah, just no words really. But anyway, that's kind of it. I hope you enjoyed watching. I apologise for the length of this video if you made it to the end. Woohoo! But yeah, thank you so much, and I'll see you in the next video. Bye!